Yeah, it's a work in progress. I think that we tend to think of populations as monolithic, that they're all the same. So we have a bunch of different studies around COVID-19 and HIV. One of the studies, called the Chronicle study, is a study that's looking at what the experience of people living with HIV has been throughout the last year in terms of their care and their access to care and their medications. And now we've launched this vaccination study, because the notion is just because somebody's positive doesn't mean that they're going to be amenable to taking the vaccine, and that not every HIV positive person is identical. There's a 30-year-old, there's a 60-year-old, there's a white person, there's a Latinx person, there's a man identified, there's a female identified person. These are intersectional identities that people have. And so the same sort of hesitation that we see in the population around vaccine in certain segments of the population is also going to be true in the HIV positive population. It's been really, really fascinating to watch the whole manifestation of COVID-19 in people living with HIV, because for some people living with HIV, this has been a re-traumatization of something that happened before. Like for people who lived through the 80s and the early 90s, before there were effective medications, this has just opened up all those wounds again. For others, it's a new wound. But nonetheless, it is a complicated situation, and we don't know what the medical implications are, let alone the psychological and social, implications are for people living with HIV around COVID. When people ask me questions about vaccine hesitancy, I'm like, what do you mean? Vaccine hesitancy is like 100 different things, right? So if I'm thinking about the 85-year-old grandma in Newark, who's African American, who has, encountered awful, awful, awful conditions with the medical profession, and is knowledgeable of the history of the African American population with regard to medical profession, that's going to be different than somebody who is, a white, right-wing man from Bedminster, New Jersey, right? And so I use that as an example, because I think within the positive population also, there probably is going to be less hesitancy, only because positive people are already so used to taking care of their health. So they are getting vaccinated for lots of other things, like, HPV and pneumonia and what have you. So if there is any hesitation, it might have to do with fear that the vaccine is not well enough tested, and that it's going to complicate their already complicated immune system.